Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. There have been many sweeping changes in healthcare in the United States in the past year or so, and our guest here in studio today with us is here to talk about some of those changes and why he chose to take a very special route in an attempt to offer the best care to his patients in view of these healthcare changes. Our guest is Dr. Joseph Berry. He received his medical degree from the Downstate Medical Center in Brooklyn, New York, completed his 3-year internal medicine residency program in Boston at St. Elizabeth's Hospital in 1987. He's board certified in both internal medicine and in geriatrics. How are you doing today, Dr. Berry?
I'm doing fantastic, Neal. Thanks for asking.
You have a practice there in New York. Could you talk a little bit about why it is that you chose to give, comprehensive care to a smaller group of people as opposed to what you were doing before the Affordable Health Care Act?
Well, I was a practicing physician here in Syracuse for 25 years, and I was doing the same thing that my colleagues are doing upstairs now, which is seeing people in 10 and 15-minute interviews and trying to just get through 15, 20, 25 people a day and to take care of the illness. What is the illness that brings you? Is it diabetes? Is it cholesterol? Is it blood pressure? Let me evaluate the illness. And I didn't get into medicine to be an illness doctor. I got into medicine to be a wellness doctor.
Ah, yeah, okay.
But the modern way of insurance companies have of looking at that is they don't value it, and they give it a value of 0. They may give some lip service and say, well, we want you to be healthy and well, but if they say, well, give me a half hour to see this patient and allow me to charge them extra to give them preventive care, and then you've proven to me that you believe in the model. But they don't really do that. So a company approached me called Signature MD, and they said, you can divorce yourself from the insurance companies. They're not the enemy, but you don't have to just try and scramble like a rat and see 20 to 25 people a day. You have time to really work on people's problems and then to work on their wellness. Not just getting the illness, but working through the illness and working on the wellness, because it's really all at the lifestyle level.
So we're basically talking about a departure from what you mentioned earlier, the traditional healthcare model of being paid by your insurance company. That's exactly what we're talking about. Your patients are paying you directly?
Well, they pay me directly, but they also still have to keep up their insurance. So in order for me not to violate my contracts with the insurance companies, I still take regular insurance. So you come and I'll bill your insurance company for that visit, whatever the level is. But then beyond that, you pay me a separate concierge or personal care management fee. It's not insurance, isn't treated like insurance. It's just extra. You know, you could have a Timex or you can have a Rolex. You can drive a Ford or you can drive a Ferrari. And I want to put myself in that class where people say, I want extra, I'm willing to pay a little extra, and I want to get extra attention, extra time, extra management, extra approach on my health care.
So how long have you been involved in this this personalized or concierge type of healthcare, providing healthcare in that way?
I took the leap to change my practice in January of 2015, so it hasn't been quite a year. And let me tell you that was the scariest business or personal, professional decision I ever made.
I can bet. I mean, you were talking traditionally or an average of 25, 26 patients a day. What are you averaging now with this, I guess, more comprehensive hands-on approach?
Roughly 10 to 12, sometimes fewer than that, sometimes more.
So average, you cut it down about half.
That's right.
Yeah.
And I need to leave time for house calls. I need to leave time for hospital calls.
Did you just say house calls?
Yes, sure, I do house calls twice a week.
You're a physician here in 2015, about to be 2016, and you actually do house calls?
Yeah, absolutely.
And do you understand how rare a breed you are?
Yes, I do. But again, I'm charging extra.
There
so
you go.
Think you charge extra, you should expect extra.
There you go. Absolutely.
Especially,
absolutely.
You know, if you get sick and you go into the hospital, that's the dangerous place a person can be in America. You've got BRE and MRSA and all kinds of other things. When you get sick, does your doctor, who knows you best, go there and shepherd you during your hours of illness? No. You're seen by a stranger, by a group of strangers. Your doctor's safely home in bed or in his office working. And, oh, yes, he'll get the reports when you're all said and done, but the doctor should be by the patient's bedside in the hospital. And that's been abandoned here, at least in the Northeast, because we have managed care and we have hospitalists. But I think that was good for doctors because we didn't have to get up at night, but it was bad for patients because they were abandoned to be dealt with by strangers who didn't know them as well.
Now,
with this practice, I have time to go to any of the 4 local hospitals, check up on people.
when you're dealing in healthcare this way, what does that change how you're dealing with pharmaceutical companies as well? And we've talked about the insurance companies. Is it the same type of deal with pharmaceutical companies? Are you prescribing what insurance will cover, or charging for non-generic drugs? How does that work?
Well, I try and not make it adversarial. I don't tell them I'm fighting with the insurance company for them or fighting with their benefits plan. I tell them I'm educating their plans, because if a person says to me, I like the non-generic, I don't want generic, it doesn't work for me, then I'm going to go to bat for them. On the other hand, if they take generic and it works for them, no problem.
Absolutely.
I've been the guy that likes to press it with the insurance companies, and if a person says, I need you to jump through all these hoops so I can get this medicine, I'm a hoop jumper. Listen, you're paying me extra. I'm going to fight with this insurance company until they see reason, until they see the logic. They know that I'm not benefiting directly by recommending this medicine or that medicine. So I have the patient's best interest at heart, and that always wins.
And it's always the best reason for making such a drastic change in your business practice is always should be in the behalf of the patient. Yeah.
Well, in my business, medicine, there's no ladder of success. I mean, I was busy. I've been busy ever since I joined my father's practice 25 years ago. I've had new people come. We're always busy. I've done everything in the internal medicine world, and I was looking for a new challenge. I could have joined a hospital. I could have become a teacher. I could have gone to work for hospice. But I said, I want to do what I'm doing. I just want a different and greater challenge. And personalized care has been that challenge.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Our guest in studio today has been Dr. Joseph T. Berry, certified in internal medicine and in geriatrics, and he believes that you should treat the whole person and not just the presenting problem. He says that there is a very real and important connection between your brain, your body, and your spiritual self. Living right now in Lafayette with his wife, Debbie, and their 2 kids, Kyle and Shannon. He's also a proud member of the Optimist Club, and he's been here today talking about some of the reasons that he chose to begin giving comprehensive hands-on care to a much smaller group of people than one would normally expect in a traditional healthcare setting. It's been great having you here with us today, Dr. Berry.
It's great to be here.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.